Hi, welcome to my website. My name is Dr. Dominic Costabile, and I'd like to take a few minutes to give you an introduction both to my website as well as my philosophy and an opportunity for you to get to know me and how I've come to the practice that I now perform. I have been a traditional family physician for over 30 years in the western suburbs here in Illinois. I am trained and board certified by the American Board of Family Practice. I did my residency at McNeil Hospital in Berwyn, and I've had a pretty traditional family medicine practice. I need to confess, I've always had a hunger and thirst for prevention. My entire family has been wiped out with cardiovascular disease, and candidly, I never knew where to find the really good stuff at root causes for how can we eradicate cardiovascular diseases. And by serendipity, along my journey over the last 6 years, I found it, and I'm very thankful to have done that. Somewhere around 2006, I had the opportunity to learn about a treatment called prolotherapy that's been around for years, and basically it's a treatment for chronic musculoskeletal pain. And I had the opportunity in 2006 to attend my first meeting with the American Academy of Orthopedic Medicine. Met some phenomenal men and women who I've come to know and love and respect, and I'm a member and I've taken many of their courses, and it's been one of the most wonderful paradigms for treatment of musculoskeletal illness that I've so far experienced, and I'm still learning as we're in the early parts of learning about biocellular medicine. Probably early in 2003, 2004, biocellular medicine, which you know as stem cells, it's all over the news, platelet-rich plasma, stromal-vascular fat grafting, and other things has entered into the realm of regenerative medicine, and I knew I needed to know more about these. So I took a hiatus and began a self-directed mini fellowship in that area, and little did I know it would lead me to 6 other areas, which I'm so thankful that I had the opportunity to study. And I'll be quick because I don't want to bore you with details. First was, of course, learning more about platelet-rich plasma, stem cells, and other modalities in biocellular medicine. That led to my learning about the use of musculoskeletal ultrasound, because you need to precisely direct these therapeutics to some very critical areas, and without ultrasound, you're not sure you're getting there. That also led to a formal training with the WorldLink Medical Group in bioidentical hormone replacement therapy, which is really prominent in reversing some of the effects of cognitive decline, also reversing bone loss, and many other entities that are preventative that are just too numerous to go into. And in other parts of my website, I'll be happy to share those with you. The other and most exciting areas were the study I began with the Institute of Functional Medicine, and that has been just paradigm change for me. Essentially, medicine traditionally is name it, blame it, apply a therapeutic to it. Functional medicine is that science of the biology of systems and how they interrelate to find root causes and then use lifestyle medicine practices to both prevent, treat, and reverse those entities. And it's just a wonderful paradigm. That also led to my learning from Dr. Dale Bredesen, who has a program called RECODE, which really is a methodology of reversing cognitive decline, which is also known as Alzheimer's. And there's much more to tell you about that, but we'll do that at a later time. To make this really simple, I want you to really focus on the simple statement. Our current health care is disease care. What we need is the paradigm of health care is self-care, and we are responsible for our own life processes, and we need to be much more aware of the impact of lifestyle medicine on that entity. The cost effectiveness, the freedom from side effects, and the ability to both treat and reverse chronic lifestyle diseases is one of the most exciting paradigms I've experienced in my practice. I was exposed to the American College of Lifestyle Medicine, which is a 15-year-old association that really is all about making the patient the center of our healthcare. We know most people want to get their weight down and take care of themselves, but 50 to 80% of them can't get it done. And in our current treatments paradigm, where we try to do chronic disease care on an acute care platform, frankly, we don't do a very good job, and we need a team to do this. We need educators, we need coaches, We need to learn the means of listening to patients' desires and assist them in their journey of changing some lifestyle habits. So in summary, it was a realization that everything I'd learned up to this point was really disease care. Do a good job of things, we're great with acute things, but chronic disease, management, treatment, diagnosis, not so much. And the thrill is that the realization of the importance of lifestyle medicine factors made me aware that, healthcare is not a pill for every ill. It's really finding a way to educate our patients about their responsibility in healthcare. And very simply, healthcare is self-care. The biggest, most economic, cost-effective, and freedom of side effects can be had with lifestyle changes, and I'm sure most of our patients will embrace if they have someone guide them through this process. And it's been like a new set of eyes and a new brain and a new set of tools in my toolbox in this stage of my development. So that's what our practice is about. I hope this gives you a brief introduction to what we do. My website has many other subsets, which has a greater discussion at both patient level as well as physician level, and I hope you'll read through and see what we offer in our practice. Thanks for the opportunity to share our life's work with you.